The theory behind scar revision is to camouflage a scar in its natural surroundings. So, for example, when you have a scar that is linear, a straight line, we aim to disrupt the shape of that straight line and make it into an irregular line. If a scar is raised beyond the level of the skin, we aim to lower the level of that scar to the level of the skin and blend it into the rest of the skin. Those are generally the basic principles behind scar revision. After we perform scar revision, scars never disappear completely. I tell patients they will always have a scar. We minimize and we reduce the appearance of the scar after scar revision surgery, many times to a point where the scar is barely imperceptible. But if one looks closely enough, the scar will be there. When the body heals after trauma or surgery, there's always a scar. And that scar is the body's response to that damage. How the scar is formed is really dependent on where the scar is located, the orientation of the scar, the type of injury that created the scar in the first place. So there's a lot of issues that come into play into how bad or how large a scar is going to be. The reduction of the scar in its natural form usually takes months. Like any other injury, scars will be pink for several months, and that's the natural process. That's due to the increased vascular supply in the tissue as that tissue is healing and evolving. As the blood supply begins to be reduced, the color of the scar begins to lighten. Many times the overall or the end result of the scar is much lighter than the rest of the skin, and that's due to the nature of the actual proteins that are in the scar, because a scar is actually mostly collagen, so that in itself causes a little bit of discoloration at the end result of the healing process. There are basically two different types of scars that we deal with during scar revision surgery. That is hypertrophic scars and keloid scars. Hypertrophic scars are scars that are wide. They are scars that have a wide central shape and tend to be noticed because of this wide shape that they have. Keloid scars have a very specific appearance, and keloid scars, by definition, are scars that grow beyond the confines of the original injury. So typically, a keloid scar can look like a pencil laying on top of the skin. It is a scar that's typically raised, and it's a scar that typically grows outside of the original edges of the incision or of the trauma. In dealing with the two different types of scars, there are many different tools that we can apply to make these scars look better. With hypertrophic scars, for example, the goal is to take what is a wide scar and turn it into a thin scar. With keloid scars, the goal is to excise the entire scar and give your body an opportunity to create a new, thinner, and smaller scar. Keloid scars are much more difficult to treat because they have a high risk of recurrence. And so because of that, keloid scars are not only fixed with an initial surgery, but there's a lot of follow-up involved with keloid scar revision. That follow-up usually involves the injection of steroids as well as some other interventions that are beneficial for the improvement of the scar. After scar revision, I typically ask patients to do one of three things depending on the location and the type of scar. Sometimes we ask patients to tape the scar with anti-tension tapes for 3 months after the procedure. Many times we ask the patient to use a silicone sheet that puts pressure onto the scar that keeps the scar flat as it heals. Other times we simply ask patients to use a silicone gel, which works in theory in the same way that a silicone sheet does, but it also helps in keeping the scar flat and within the confines of the original injury.